Hi, I'm Alexis Moore. I'm a LPN student at Bates Technical College, and today I'm going to be doing sterile dressing change with wound site assessment. All right, before I begin, I would do my LPN and welcome steps. Part of that is hand hygiene. Go ahead and read.
Okay. Fold back edges of a plastic bag to form a cuff and place within reach of your working area.
All right, so first I'm just gonna open this up, trying not to contaminate. Going to just reach in and grab the bag. Open this up. Not turning my back on it. And I'm going to set that right now.
Don clean gloves.
And I'm going to don clean gloves. Do you mind recording over there? Just so I don't have to turn my back on the sterile field.
Position patient comfortably, but allowing easy access to the dressing.
All right, are you comfortable? You are. Okay, I'm just gonna remove this so I can see your dressing.
Place waterproof pads under patient to catch any drainage.
Going to take my waterproof bag, or bottom, and put that underneath her.
Drape the patient to expose the area of the wound, but ensure modesty. Loosen the tape securing the dressing. Pull the tape toward the wound.
So I'm pulling it towards the wound, removing it.
Remove without separating the healing wound.
All right, and then I'm just gonna lightly remove it.
Moisten the gauze with sterile normal saline if it adheres to the wound.
I would moisten it, but it's not adhering to the wound. So I'm going to remove it.
Gently remove the wound packing. Packing should stick slightly to the wound. This is desirable so that it helps remove debris and dead tissue. Remove any packing material from tunnels as necessary, helping to debride the wound.
So I removed it gently, not to disrupt it, and then there are no tunnels, so I don't need to remove that packing.
Pull gloves off over soiled dressing. Discard the gloves with dressing inside.
All right, I'm going to remove my gloves with the dressing inside.
Okay, all right, thank you.
And dispose of it.
Don clean gloves.
Just move your table. Oh, are y'all done for today then yet? Because we had 2 times with you.
I'm going to go ahead and remove my watch.
Because I got other tables.
Observe for any drainage from wound. Note amount, color, odor, and consistency.
There is no drainage from the wound, so I don't need to document the amount, the drainage, the consistency.
But you would document none.
I would document that there's no drainage.
So what was the sterility issue with the leg?
Observe interior of the wound for any blackened or yellow necrotic tissue.
There is no blackened or necrotic tissue, so it seems to be healing properly.
Properly healing tissue should be red and moist.
And it is red and moist.
Use sterile cotton tipped applicator to measure depth of the wound at its deepest point in centimeters.
Okay, I'm going to
And it's not a
remove
deep wound either.
cotton tipped.
It's not like you're, and I practice on this one too, so I'm gonna be like, Don, I'll watch you.
So that's just and I'm going to use this to measure, putting it in the deepest point. Make sure not to touch.
Do we report you?
Okay. You guys got 10 centimeters. The wound is about 2.5 centimeters. Anything else?
Document.
And then I would document that.
Use sterile cotton tipped applicator, gently probe any tunneled areas within the wound and measure the length.
At this point, I would take the other one out and probe any tunneled areas, but there are none on this patient.
Using a disposable transparent measuring sheet or other facility provided device, measure the largest dimensions of the wound in both directions.
So now I'm just going to measure both dimensions of the wound. So the length is approximately 14 centimeters, and the width
Yeah. As soon as I'm ready, then you'll hit
is 2.5.
Yeah.
So I'm going to go ahead and dispose of this. Are you going to be my assistant?
And document.
And then I would go ahead and document my measurements.
Note wound edges for rounding toward the wound bed indicating healing. And document.
The wound edges are round and it does appear to be healing. So I would document that.
Inspect skin around wound for evidence of inflammation and document.
The skin around the wound is lightly pink, but it appears to be healing just fine. I would document that.
Remove gloves.
Now I'm just going to remove my gloves.
Tear 4 strips of 2-inch paper tape. Fold over each end to form a tab and lightly stick them to the ends of the table.
I'm just going to put on some other gloves.
Okay, so you don't want us using the water anymore? Okay.
No, because I want to.
Strips should be long enough to picture frame the gauze
When
dressing.
you're practicing, it's good because you need to kind of see what that looks like, but like when you're doing that, it doesn't make any videos.
Go for it.
Going to take my tape,
Okay.
remove 4 strips
All right,
about
this is
2
my
inches
first
long.
packet. Doing this for real. Allergies.
Yep. Check allergies. Sorry, my nails couldn't get under it.
That's because they're the right length.
You got it, Dawn.
Hygienic.
Somewhere over there, though. Way over there.
Oh goodness.
How did you feel?
About this? I messed up because I got.
Sorry, my glove got stuck.
It's okay, no worries.
How many times did you practice?
Alright,
Open sterile supplies using one package to create a sterile field.
alright.
Why not?
So my sterile supplies are already open, so I'm just going to very carefully grab the sterile field, just holding the outside to open it.
Yeah, but, oh yeah,
Open a bottle of sterile normal saline. Pour a small amount of the saline into a waste container.
So before I do that, I want to dump my sterile stuff in. So
Okay.
before I complete that though,
You're
I'm
talking
going to
about the
remove this
container.
so it doesn't get in the way.
It's open air, so it's not.
Dispose of that.
I know they say it is.
Then I'm going to take, just touching the outside, because I don't want to contaminate the sterile
Would you
field
suggest,
inside,
like,
I'm just going to
pouring all the
dump it
contents
onto
on
my
the
sterile field.
Do you think that's a better way of doing it?
Well, yeah, I would pour them like.
Beautiful.
Then I'm going to grab the sterile water, and I'm going to open it up,
Because if you do it, you're actually.
pour a little bit to get any contamination off, pour a little bit in there, and then pour it into here.
Small amount over God's packaging for basin. Don sterile gloves.
At this point, I'm going to remove my gloves. And then don my sterile gloves. I'm going to stand this way so I don't turn my back on the sterile field.
Okay,
So I would
go.
open them up,
Record video.
dump them out.
Going.
1, 2, 3, go.
Hi, my name is Dawn. Moore.
Only touching,
LPN
you can come over here.
Dates.
Only touching the edges.
For me, here for you today.
So first, I will be at the patient's room, checking the records, what needs to be done, and gathering my supplies.
Trying to make sure it doesn't fold in. Alright, then I'm just going to remove one glove, touching the inside.
Good morning, my name is Dawn, I'm going to be your nurse today. Okay, wash my hands.
Then I'm going to take this hand and slide it underneath the cuff on the other side.
15 seconds.
And now I can pull that over
Gloves on.
and
Okay, I'll
pull
do,
that over. Now I have my
confirm I
sterile
have the
gloves on.
patient.
Cleanse
Can
the
you
wound
give
with
me your name and date of birth, please?
antimicrobial agent.
So I checked beforehand and my patient has a iodine allergy. I chose to get the pack for the wound care that doesn't contain any iodine. So I can go ahead and grab.
It's funny. Okay. Mary Smith.
Use a technique that prevents transferring microorganisms back to a clean area.
We will be sure not to
Use a
use
new
that.
cotton ball or gauze for each stroke.
Okay.
Alright, and then I'm just going to take it,
Going
roll
to
it
close the wound.
down the sides of the wound, going in one direction, dispose of it. Grab the other. down the sides of the wound and dispose of it.
Using forceps, cotton-tipped applicators, and/or gloved fingers, gently place packing material into wound, covering all the tissue.
So for this, I am just going to pick it up, separate it out, dip it in, and wet it, and then I am just going to place it. Using the forceps to kind of push it in there so I don't actually touch the wound.
Oh, and I forgot to
It's a lot
ask
harder drier.
permission from the patient to change her wound dressing. So
Being careful not
is
to
it
force
okay,
it
Ms.
in,
Smith, if we
just
get
being
you a wound
gentle.
change?
Cover wound with 4x4 gauze sponges.
Oh,
Dispose of
well, I
those.
checked her bracelet for the iodine allergy, but I should also ask the patient. So,
Then
Ms.
I'm gonna
Smith,
take
do
my
you have any
4x4s and
allergies
cover
before
it.
we get started?
Apply ABD dressing as outer covering for dressing.
To iodine and
I'm going to
sulfur,
grab
I
the
think.
dressing, place it over top,
Okay.
And use your previously torn strips of 2-inch paper tape to form a window frame around the outer edge.
making a window frame around the outer
Oh,
edge,
that's right. My
I'm
assistant
grabbing- yes.
is going to grab me a
making
pad
sure not to go
and put-
over the wheel. At this point now, my gloves are not sterile.
Yeah, I'll take that. Okay. Thank you. This.
But it doesn't matter because I've already done all the parts with the wound.
The facility policy recommends place date, time, and your initials on one of the pieces of tape.
Alright, and then after that, I would take a pen, write the date and time that this was put on so that others know,
And your initials?
Seconds.
and my initials. I would cover the patient and I would clean up my mess and complete my end steps. And that is sterile gloving with a.
Remove your gloves.
Oh, do I need to, okay.
Yeah.
Well, and then I would remove my gloves
And to the bit and then I
before all my cleaning.
I'm too
These are
early.
contaminated.
I'm too early.
And then at this point, I would do hand hygiene
Back on.
and complete my end steps. And that is sterile gloving and a wound change.